Let's talk about your cataract surgery. You know that everyone has a natural lens inside his or her eye, and that lens focuses for you all through your life. Well, as you age, that lens can get cloudy, and that's when we call it a cataract. And if it's cloudy, you can't see through it. So we need to remove the cloudy cataract lens and replace it with an artificial lens called a lens implant. Now that lens implant is artificial, so we can put whatever lens in there you want to give you really good focus. That's why many people after cataract surgery don't need glasses very much. That's one of the nice things about getting your cataract fixed. Now, cataract surgery is a very quick, safe, and easy procedure. It takes only 12 minutes to remove a cataract. We do one eye at a time. You come in, you have it done, you go home, you can be up and around. Right after surgery, you don't have to be lying in bed like the old days. You don't have to worry about the bending and the lifting like you used to. It's just done with eye drops to numb your eye. You don't need a shot. You don't have to wear a patch. We don't even give people a pain pill, not even a Tylenol, because it just doesn't hurt. We dissolve the cataract, wash it out through a little tiny incision. For most people, the incision is so tiny it doesn't even need a stitch. It just seals itself. And because of that, you can sit up right after surgery and already start to see. That's how quick it works. Now, it's still surgery, and you got to take it very seriously. You know, any kind of surgery, no matter how quick, safe, and easy it is, there's always a risk. And you always worry about things like infection and bleeding and problems healing up. But bleeding is not a big worry in cataract surgery because there are no blood vessels in a cataract. We always worry about infection, though. You know, a bad infection, you could lose your whole eye, not just your vision. So we don't want to take any chances with that. If you're coming down with a cold, sore throat, toothache, sinus, skin rash, anything that could spread an infection to your eye, you give us a call. We'll put it off till we're sure you're over it. If you haven't had a checkup lately with your medical doctor, you get a checkup, make sure your heart, your lungs, your blood pressure, all that stuff's good, so we don't have any worries there. Now, I told you that we replace the cataract with an artificial lens, a lens implant. And you actually have some choices when it comes to what kind of lens implant you want. The standard traditional lens implant that's covered by all the insurance plans, Medicare and everything, so that it doesn't cost anything extra, is called a single focus lens. It gives you very good quality vision, but it only focuses in one place. Most people get their eyes focused at distance, and then they just have to wear glasses for reading and in between. If you have astigmatism, the astigmatism isn't corrected by the single focus lens. So you would still need to wear glasses both for distance and for reading if you have astigmatism and get the single focus lens. Now, there are lenses that correct astigmatism, so for people who want them, those are available, but they're not covered by any of the insurance plans, and they do cost extra. So if that's something that the measurements show would be best for you, you may want to consider the additional cost of getting an astigmatism correcting lens. There are also lenses that give you range of focus, so you can see both far and near and in between and not need the reading glasses. Those are still more expensive, but they are available, and they're wonderful for many people who benefit from having that full range of focus. If that's something that you're interested in and the measurements show that it would be appropriate for your eyes, we can consider that for you. So after we're done with your exam, I want you to talk to our staff, and they'll give you more information about whichever lens you feel is the most appropriate for your visual needs. And we're going to take good care of you and make sure that you have a very good experience getting your cataract surgery done. Let's talk about laser cataract surgery. You know that lasers are used in lots of different surgeries nowadays because lasers can be more precise than the human hand. There are two situations where the laser could be important for your cataract surgery. One of those is astigmatism. Astigmatism is where your eye is not focused well because of the shape of the eye. The laser can help correct the shape of your eye, or it can help align a specific type of lens implant that can correct astigmatism. Not everybody has astigmatism enough that it would cause a problem to need the laser, and the measurements that we do for your eye before surgery will tell us if this is important for you. So this is something that we will discuss when we have your measurements, so you'll know if this could be an important aspect of using the laser for your surgery. The other way the laser helps is in some people who have very hard, dense cataracts. The hardness and density of the cataract means it needs more ultrasound energy to dissolve the cataract and wash it out of the eye. The amount of energy that the ultrasound is required to use can be damaging to the inside of the eye if it's excessive. And the laser helps to break up the cataract into smaller, more soft fragments, so the lens is easily dissolved by the ultrasound and much more gentle to the structures inside your eye. Again, the measurements that we do of your eye before surgery will tell us whether this could be something important for you. We want to give you the best result from your cataract surgery, but laser involvement with the cataract surgery is expensive and it's not covered by insurance. So we will let you know if this is something that could be important and worth it for you to consider. And once we've discussed this, you can make your decision as to whether or not you'd like to have the laser help perform your cataract surgery.